Hey, Remarkable Lifers, this is KJ. Craig is behind the camera. So, I have some news. I am going to be going on a medical journey here in Mexico, and I will be taking you guys along with me. I hope that this adventure, I don't know if that's the right word, Craig, adventure?
It will be an adventure, but
it's going to be an adventure. Something has come up, and I thought this would be the perfect opportunity. We get a lot of medical questions and stuff about the health system in Mexico and whatnot, and what better opportunity than to do a first person, this is what's happening, so you guys can see it in action. Okay, so disclaimer, this is not medical advice or anything like that. Consult your own physicians and do all that sort of stuff. Don't think this is medical advice. So I am okay. I have nothing life-threatening, but I'm going to rewind a few months. So, maybe about 6 months ago or so, I kind of started noticing a little discomfort in my right side. No pain, nothing that was painful or kept me up at night or anything like that. Just something didn't feel quite right. And, I kind of just let it go, and it would come and it would go, and I'm like, okay, maybe it's gas, right? I don't know what happens as we get older, I've never done it. So I just kind of, everyone's like, well, things just kind of start hurting as you get older. And so I kind of let it go a little bit. And then I talked to him, and then the uncomfortableness kind of came and stayed. So I asked my doctor and my primary care physician here, and she was like, well, if you're not having pain, it doesn't sound like terrible, but if you want to get a sonogram, go get a sonogram done. And she gave me the name of a clinic and all of that. And I just didn't do it for a couple of months, and it's gotten persistent. So there's no pain. Let me just keep saying that. There's no pain. It's just a persistent uncomfortableness. And so I decided to go get the sonogram, went and got the sonogram done, and went to contacted the doctor, had my results, because they give you your results at the place you get your sonogram done, and you take them to your doctor. And she pulls it out and she goes, wow, isn't that pretty? And then she starts reading the doctor's notes who did the sonogram about, their assessment of everything going on in here, and her face was all contorting and looking horrible. And I'm like, what is it? What is it? So KJ has a 1-inch gallstone. It's like a big rock sitting in my gallbladder. And I am going to have gallbladder removal surgery. I'm not looking forward to this. What I want you guys to know is, how does this all work, right? So I have a primary care doctor here in Ajijic. I complain about something and, to her, and the doctors here will tell you, you need to have this done. And they may or may not be able to give you the name of a clinic or somewhere where you can go get a test done, your blood work, whatever. Most of them will. And then, okay, it's your job, it's your body, it's your health, it's your job to go get these things done. The doctor is not going to harass you about it. They're not going to hound you about, did you get this done? They're not going to withhold your medication if you don't, because almost everything is pretty much over the counter. So it's your responsibility to go get this done. You get it done. You get your lab work, your blood work, your scans, whatever, x-rays, whatever it is, they're yours. The clinics give them to you. You take that to your doctor. Okay, and then they'll take a look at it and whatnot. And what's really cool I've noticed about, the system here in Mexico, like Craig had an MRI done several months ago. I just had this sonogram done. The clinics that do these, they have a professional on staff that reviews the results and writes up their analysis and all of that sort of stuff. And their analysis goes with the scans. So when you get it, came in a nice hefty envelope with, this. So I take it to the doctor, and then they review it, and there will be recommendations and stuff in the write-ups of what might need to happen. So my doctor, she gave me the names of 2 different surgeons, where their offices are here in Ajijic, and it's my responsibility to go talk to these surgeons and see which one of them I want to do business with, which one of them do I trust, get cost estimates, which one do I want to use.
There's an urgent care, pet place, health and travel solutions, PhysioFit, Chapala Med Pharmacy. Oh my gosh, there's all kinds of stuff back here.
Okay, so today we are going to go try to talk to the surgeons, and I'm here outside of Quality Care, which is the office of Dr. Valenzuela. So let's go in. Luckily, somebody in my ceramics class said that her husband just had his gallbladder removed a few months ago, and this is the guy who did it. She also said good luck getting an appointment. She said it's anytime soon, that they're really booked up. So let's go find out. So literally 2 minutes later, went in, and this doctor is only here on Mondays. They did give me an appointment for next Monday. So this is Monday, so it's a whole nother week away. So, okay, if I look shell-shocked, it's because I kind of am. Went in just now for an appointment to meet the surgeon for my gallbladder surgery, and we talked for just a couple of minutes. He looked at my ultrasound, and he was like, do you want to have this done as soon as possible? And I was like, well, yeah, and kind of explained to him some things going on in my life. He's like, okay, let's do it tomorrow. So apparently he has the day scheduled off tomorrow because he has something he's doing in the morning, but he's going to go, he's concerned about the size of the gallstone, so he's going to actually go do the surgery tomorrow afternoon. So I'm just kind of shell-shocked.
So tomorrow, Tuesday. Today's Monday.
Yeah, so tomorrow's Tuesday, and he's going to do the surgery in the afternoon. I'll probably have to spend the night in the hospital and get up in the morning.
Oh my. Okay.
Yeah. So now is the mad dash to figure out how to get up there, all that kind of stuff, get the money transferred, all that kind of stuff. So it's a little hectic.
We'll talk about the money later.
Yeah.
Hi.
Hello.
So we're packing up our bags and getting ready to go. This is Tuesday. No, what day is this? Tuesday?
Yes.
Tuesday morning, and KJ is about to get poked in the belly. And we were so lucky to get somebody to take us.
Yes. Oh my God, yes. Gus, there's just not words. I mean, so last minute, this is like an emergency kind of a surgery. We saw the surgeon yesterday, and boom, they're doing it today. And I tried several different drivers, couldn't find anyone, a driver. And so I was like, I'm going to ask a friend. And so Gus was the first person I reached out to, and he was like, absolutely. So
we've had several friends step up, and thank you. We won't mention
I'll mention Steve Cross has helped significantly with this.
Yes.
Thank you so much for your assistance.
You know what you did.
Yeah, you know what you did.
So KJ's going to finish up getting ready here, and we'll take you along a little more.
Yes. So we're here at the hospital, and it's Hospital Joya, Joya, and I've done all the paperwork. A lot of traffic getting here. We were late, but we called ahead and they said that was fine. So done all the paperwork, and now we just wait. No puedo caminar.
Buena suerte.
It's a boy.
Just think, honey, we'll be a family of 3. You, me, and the stone.
It's a backpack.
Ooh, he gonna get his clothes off.
I'm going in the bathroom for that.
This is a nice room. And this is his bed. And then Melissa's here. You have an old person shower.
Mm-hmm.
It's actually very nice. Okay, go change. I got to get you in your robe. He's in his dress. It's very snazzy. It fits you well.
It's 2024 couture.
Oh! Hi, so how are you feeling? This is still before surgery.
Well, I'm nervous, obviously, but
Right.
I mean, everything's fine. I've got my friends are here. You're here.
Do you mind being on? These are the wonderful people that drove us here.
Yes.
And our translator.
Yeah, I mean, I'm okay. The surgeon's already come in, said hi, and he went to go grab dinner, and he's like, it'll be a 30-minute procedure. He said I do it all the time, and get in, get out, and they've got the IV going with anti-nausea medication and all that stuff. So
We're getting started.
yeah, now I feel like I have to pee.
Well, we know how to do that.
They just put the IV in, of course. Now,
Of course,
to go to the bathroom. Yeah.
Okay. Well, we'll keep you comfortable. So, go to the bathroom. Just go to the bathroom now, so I can film the back of your gown.
No. More happy pills. More happy pills.
Happy pills are later. Okay. So they just came and got him, wheeled him back. He's nervous because he's never really had anything like this. He did have a lipoma removed that required kind of mild sedation, but this is the first internal surgery he's had in his adult life. So, lots of reassurance, and he's doing great. He's in very good hands, and I am just waiting. So they said it should take about a half hour, probably total an hour by the time they get him up there and back. So then we start getting him out of recovery. They'll put him in recovery first, and then bring him back down here. So I think I'll be free after that for a minute while he's recovering. But all good. Waiting in the hospital room now. My friends went to get dinner. They've been so amazing helping us translate, which honestly, you could definitely do this with some sort of translation device, but it's really nice to have somebody with you to really explain things, especially with any more complicated issues. But the room is gorgeous. Very nice accommodations. KJ was taken very good care of. Everybody was so nice, very professional, very, very good, very high quality care. I will say that they were great with letting us know all the rules and regulations and what you can do and what you can't do. Don't eat in the room. Only the patient can eat in the room. So that's something to know. You can only have up to 2 people with you, but since they're slow, they're allowing our friends in here with us. Then there's restaurants and everything around. They have a complete list of places that not only deliver, but you can order and they deliver it to the front desk, or they'll deliver it straight to the lobby out front. And then they have a dining or an eating area out there where you can go and sit, waiting area. Very easy to get around. It's not a massive hospital. It's Hospital Joya.
Deep, meaningful conversations, but they want you to move from this bed to that bed. They just use their hands. And we understand that, yeah. So,
The patient is talkative.
Do what?
The patient is talkative.
Yes, the patient is talkative.
And the patient has a little...
I have a plushie.
That was his gallstone.
My gallstone is a reindeer?
It was that big.
It was a big gallstone.
Are you all done?
All done.
Well, still got to get all your stuff out. Final little steps, but they've got you.
Yeah, trying to get stuff packed and finished up. But they brought me they brought me breakfast this morning. So I don't remember what all happened yesterday in our filming last night, but
it could be because of the medication.
Maybe. But they brought me some liquid. I had a glass of apple juice, some Jello, and some tea. Craig sneaked out. Not sneaked out. He can go out. Craig went out, but he snuck me in another thing of Jello from the OXXO. Thank you, Craig. I was starving.
Sugar-free.
They even brought me my...
Ew. Ew. Trigger warning.
That's not a trigger warning. It's rocks in a jar of water or something. So
Yeah, well, anyway.
they actually look like garlic cloves sitting in... They look like garlic cloves.
No, stop it. Stop it.
You're like, I will never unsee that.
Stop it. I cannot understand why you wanted to see that. Anyway. All right, now he's taking him home. Lord. I wonder where you're going to live.
Everybody takes theirs home.
No, they don't.
Yes, they do.
No, they don't.
Yes, they do.
No, they don't.
I've known so many people who pulled out their gallstones.
Okay. All right, well, we got to get ready. No time to waste.
Okay, so if you haven't, I just really wanted to say, I know we're trying to rush and get through all this, but it was really, this has been a wonderful, wonderful experience as far as having surgeries go. They didn't bother me all night long asking for me, checking my blood pressure every 30 minutes and doing all that kind of stuff. They let me rest. It was really nice. They came in when the IV bag needed to be replaced. So yeah, it was really, really good. And we'll do some more talking.
We'll debrief on it. Yeah. Okay.
Okay, so here we are, 9 days post-op. I know I'm wearing the same shirt, same cap, but there's a reason for that. After my surgery and everything, I had a friend come up and just kind of look me in the face, kind of like I'm doing to you now. And he was like, you look so much better. And I'm like, what do you mean? He said, well, ever since I've known you, your face has kind of had a little squinch to it. And he's like, and that's just gone. So Craig suggested I wear the same shirt and the same ball cap. That way, whenever I look at the video, I can actually see for myself if I look better. So anyways, 9 days post-op. Here's where I am. I feel amazing. I literally, within 3 days after my surgery, I was up and walking around. I was still on pain meds, but I was fine. It was laparoscopic, and it was, I had some soreness, but really nothing major. I didn't have any stomach issues or anything like that. Everything was great. I was feeling good. Here I am 9 days post-op, and I feel like I lost 15 years. I feel youthful and healthy. And the thing is, so after, I think where we left off, I was probably in a hospital bed, probably doped up and don't know. But a week after my surgery, I went to see my surgeon for post-op. And I'll tell you, it's a very weird experience seeing pictures of the inside of yourself. But he had done this so I could see the 1-inch gallstone that I thought I had. When they did the sonogram, it was actually kind of tilted. And so it was actually significantly bigger. It looked like it was about that big around. It was huge. He had to break it up into several pieces to get it out. And in my case, my entire gallbladder had been encapsulated in scar tissue. And he said that happens because your body is trying to protect the organ and all this other stuff. But he said they really only see that with like extremely advanced cases. And that I had been suffering for years. And the weird thing is, I didn't have any pain. I just had some uncomfortableness in my side that had been persistent. And it just, looking back at the way I felt, my emotional state and stuff, I can see now where that pain was manifesting itself in my emotional states. So something to watch out for. I have a very high pain tolerance, which is probably not going to be good if I develop something else. So I really have to pay attention and watch out for that. So I want to give a shout out to my surgeon, Dr. Valenzuela. We're going to have his website down below, might be popping up here or something. Craig, the editing genius, will figure all that out. But if anyone is interested, he is absolutely amazing. He does his website says Dr. Hernia, so he does specialize in hernia repair, but he does anything and everything gastrointestinal. We talked to him about this. Obviously, he did a gallbladder removal. He does anything gastrointestinal he takes care of, including cancer removals. So thanks, Dr. Valenzuela. I swear you saved my life. I also want to do a shout out to our friends Gus and Mario. You guys, lifesavers. They were wonderful and jumped right up and took us to Guadalajara. They sat with Craig until I went into surgery, and then they showed up the next morning and brought us back home. And I can't thank y'all enough for that. You're wonderful friends. The hospital staff was great. We played with English and Spanish, and we figured it out, and we communicated just well and great, and everything was a lot of fun, as far as can be in the hospital. But they were so wonderful and so caring and nice, and I had food brought to me and everything. And so some of y'all are probably going to be asking, what did this cost? And the thing is everyone's surgery is unique, and based on your specific case, the price is going to fluctuate. What I can say is, in my experience, we paid one lump sum to the surgeon, and he took care of paying the hospital bill and all of that other kind of stuff. Your situation may be different, but it felt kind of medical tourism sort of package sort of thing, and it was great. It made it very simple. So what I will say is, in comparison to my experiences in the medical system in the U.S., the price of this was significantly lower than my deductible on my U.S. health policy. We literally probably wouldn't be able to afford to have this done in the U.S. It would have been crazy. The level of care was better than anything I ever had in the U.S. In a hospital, it felt very personal. I didn't feel rushed. It was very much, it just felt like I was the center of the universe of the people who were involved. It was just a very high level standard of care. And every piece of equipment, everything I saw was state of the art. It looked wonderful. When they wheeled me into the surgical bay, I swear there were 15 people in there. And they were all saying hi and waving and talking. The anesthesiologist knew that I was scared to have surgery, and he held my hand and was just very kind. And it was just such a personal experience, and I can't thank everyone enough for that. So I hope this has helped you guys. I hope that somebody finds benefit in this. And if you have any questions or anything, feel free to reach out to us via our website. There's a contact form. And take my advice. If you feel like something's going wrong with your body, get on it. Don't wait like I did. I could have regretted this in a very bad way. So thank you very much. And if you haven't already, go find your truly remarkable life.